Thriving in 3. Guess what we're talking about next?
What are we talking about?
Botulinum toxin in the Masseters.
Okay.
One of my favorite treatments.
Is it?
I did one of the first studies on this.
Yeah?
Yeah, it gets great results.
Why did you do the study?
I just did because they selected me because I was talking about it all the time. And I started doing it early on in Asia. Okay, let's get to it because we only got 3 minutes.
Okay.
There's a lot to talk about. Okay,
All right,
so when
tell
you
me-
inject this area, you can grab that masseter and you can feel it. I'm sure you know what I'm talking about, right? Sometimes you see it from the door.
And how many, there's a couple of bellies to the masseter.
2.
Okay. Not 3?
No, really it's 2.
Okay.
Okay, so when you inject this, and I've seen many people make mistakes just because they go too far anterior. So the key with treating the masseters is to get it into the muscle and don't go too far anterior.
What happens if you go too far anterior?
You will hit the rosarius muscle and you can affect the smile, and that could be a problem because people will say they can't get a full smile, and sometimes you don't even see their smile being affected, but they feel it, and I believe that gives you feedback. I believe they have a psychological feedback where they're not as happy because they can't get a full smile because you get too far anterior.
So how far anterior do you go?
So you stay within this. I stay a centimeter behind the anterior border of that masseter muscle that you can feel and grab. I stay posterior, inferior. If you get into the parotid, it's okay because the parotid gland will atrophy also.
And you get about 75% coverage in some patients anteriorly of the parotid over the masseter.
Yes.
And so how many injection points are you doing here?
So in this clinical trials, when we did this, we did sometimes 2 different injection sites, but sometimes or 3 different injections. In the study, we did 3 injection sites, but oftentimes I'll just do 2 injection sites in clinical practice. I think that's enough.
And what are your landmarks here?
I just go right smack into the middle of that muscle, into the fullest part of that muscle.
But staying kind of
inferior and posterior
to a line, kind of an imaginary line drawn from the oral commissure to the earlobe so that you also avoid going too high and getting the zygomaticus.
Yes.
Cool. And then how long do you tell patients that it's going to take in effect?
So this will last up to 8 months, even just with a small dose. So how many units do I use?
Yeah.
It matters a lot. You can go 24 to 48 units or 12 units per side or up to 24 units per side. And I've done clinical trials on this as well. They both get you long-lasting good results. There's maybe a few less AEs if you go with a lower dose. I will oftentimes do 20 units per side.
20 units per side.
Yeah.
If someone is over the age of 40, I definitely evaluate the jowls because you don't want to make that worse and you don't want to make the anterior face look even more heavy. So you could always start with even 12 units per side and then invite them back at a month and then see if they can tolerate adding more. And sometimes I see that patients that clench, and we published this in 2016, they start to engage their platysma. So now you've left platysma unopposed, kind of similar to you only treat the glabella and you leave the frontalis unopposed, then that starts to pull down, making the jowls even worse. So you might start treating both over time.
How many cc's do you dilute your toxin with when you do this?
I do it 2.5 cc's.
Yeah, I do 3.3 cc's, but you can do that just as well.
Yeah.
And then do you ever worry about people getting atrophy in that area or thinning out too much or getting hollowed out in that area?
I do. So I definitely only treat no more frequently than every 6 months. And I find that after 2 treatments, I can go with less amounts over time. So if they started off with 12 units per side, I might even drop it down to 10 units per side over time.
Yeah, I agree with you. And a couple other things I want to mention about this is bruxism, where people grind their teeth. I notice these are my happiest patients because their grinding goes away.
I do, but sometimes I also know that those patients come in just for the relief and sensation and bite force, but it's really something to remember is that your temporalis, your medial and your lateral pterygoids are also involved in that biting and clenching sensation. So if they're atrophied in the masseter, start looking elsewhere.
Because it could be the temporalis muscles that are large. Will you inject those?
I do, and I usually do about 12 units again per side. Usually one side's more dominant than the other. We tend to chew on our more dominant side, so I might add 10 to 20% of that amount to the more dominant side. And
the aesthetic result from treating masseters, I really think it's fantastic. It takes a face like this and turns it to like this.
Which is what I need right now because I'm pregnant.
Tomorrow that might change.
All right, guys.
Wait, one more thing before we go. One of the easiest treatments to do, I think.
Yeah.
It's really not hard to do, so simple.
And brings high patient satisfaction.
Yes, that's what we like. All right, I'm good. You good?
Yeah, now you can thrive in 3 minutes in treating the master.
Masseters. Thanks for watching, and please hit that like button.
And make sure to click on subscribe so that you can stay most up to date on all things thriving.
Like me?
You need to subscribe.